Welcome to the Beauty Equation podcast, where beauty meets biology, psychology, and art history. This podcast is hosted by myself, Dr. Christelle Oliver-Dussault, Dr. Harpreet Lotay, and a beauty industry expert, Amanda Manholt. This is your space to reclaim agency over aging and beauty on your terms. We're cutting through the noise with evidence-based insights and real talk about aging, self-perception, and modern treatments. No quick fixes, no fluff. Just honest conversations to empower you to define beauty for yourself.
Welcome to the Beauty Equation. I am back with my two amazing friends, Dr. Harpreet Lotay and Dr. Christelle Oliver-Dussault. I'm Amanda Manholt, and we are the Beauty Equation. I am so excited to have this little chat tonight because I feel like this would be one of the conversations we would have in the back of the clinic. And oftentimes we're scratching our heads and thinking, well, why do people think the things they do? And why do they do the things they do? And one of the things I hear, and I think it's been said often, is what in God's green earth did that woman do to her face?
Yeah.
And
And I think the last episode we talked about was, making these decisions without fear or regret. And I think that's one of the biggest fears that people have is they're going to end up looking weird. And, I don't want people to be having a conversation about why I look weird. But there's a rhyme and reason to why that happens. And we're going to talk about that today so that you can avoid the pitfalls that sometimes are made when people go down the road of choosing aesthetic treatments.
yeah, and it's everywhere. So from, social media to the movies to the grocery store. And I think one of the comments I get a lot is, I don't understand how, that person that has seemingly more money than they can spend in a lifetime looks so odd. Like, so those treatments just can't be for me.
hmm And if
Yeah.
you look at celebrities, there are some who age, I'll use the word that we hate to use, but gracefully, or look like they've had very few tweaks, but have definitely had treatments, and others that their face becomes completely distorted and they no longer look like themselves. And that can be really confusing when you see that broad range of like, well, how I want this, so how do I avoid getting to that?
It's a great question. And to your point, Amanda, people think that money equals results. And we have seen celebrities that, as you said, have all the money in the world, but they end up looking uh, weird. And
Like
a part of the
otherworldly.
yeah, like alienized, right? That's a
Yeah.
term that we use in aesthetic medicine, and I believe that that comes from self-direction, So you have somebody that doesn't really have a medical background, they don't really understand anatomy, but they think they know what they want and they're directing the provider. And you have a provider that is in a hard place because they might not want to lose a celebrity client, or they might think that that actually looks good, and they're sort of put in a position of doing something that's not quite anatomical, and I think that's key. So understanding anatomy and then understanding how the face naturally ages will help you create treatment plans for patients that keep them looking natural. So it's sort of a two-sided thing. It's the provider, but also the patient. In the case we're talking about, celebrities pushing the provider to do a particular thing and not understanding anatomy. So in celebrities that happens. Um,
Yeah,
and
and I
then
think these
Mm.
are put in a very difficult position because their appearance matters to so much because that's their business card, right?
yeah,
They're being judged on their appearance constantly, from whether they're being filmed on set or having photo shoots done where it's airbrush, or getting
yeah,
those god awful TMZ shots where they're coming out of the grocery store with nothing on. It's relentless, and you can see how that would get to any person where you're constantly looking in the mirror and picking one small thing. And that distortion usually isn't something that happens with one appointment or overnight.
no,
It's gradual erosion of self-perception,
hmm
and
hmm
then chasing those things and not having the opportunity to step back from what's actually going on.
100%. It's like watching grass grow, right? So I'll
Mhm.
often talk to people and say, like, if you sit there in your lawn chair and you watch your grass, it doesn't grow. Right? It doesn't change. And we are faced with our face every day. So we've talked about this on other episodes where there's mirrors everywhere, reflective surfaces everywhere, cameras and screens that we're on all the time for work and for other reasons, FaceTiming people, whatever. So it is like watching the grass grow. You're sitting there and you don't notice day to day that things are changing, but go away for a vacation, come back in 2 weeks. So you're like, it's 6 inches longer, right? So
Mhm.
I think that happens, that sort of distortion. And yeah.
And I think it's interesting that people will often attribute to these celebrities that look odd on Botox. I
Yeah.
hear that a
Yeah.
lot.
Yeah. That's it. Yeah.
Or
Yeah,
and I'm thinking,
Botox gets such a bad rap.
it
It
really
does.
does. I'm like, I don't think that's, you
Mhm,
know, so is it Botox? Is it filler? Is it surgery? I just saw a
mhm.
post of Kelly Osbourne, Ozzy Osbourne's daughter, and showed
Uh,
her. It was 4 images. I don't know if any of you guys saw that, and it was her as a cute little kid, and then her as sort of the teenager phase, and then her. I'm assuming in her as a young adult, and then now.
mhm.
Mm.
If I had to guess, I'm thinking she's had her buccal fat removed.
Yeah.
Yeah, there's been a lot of
Because
post treatments that she had done.
whoa, and so sometimes it's surgery, sometimes it
Mhm,
is filler, and sometimes I guess it could be Botox, right? I mean, there's a
Yeah.
certain politician in the US that's had some very interesting eyebrow positioning over the last couple of years,
mm.
which brings me to this. I mean, do I get to talk about Mar-a-Lago face? Like these very well-to-do, wealthy people, yeah, I guess in a certain, I don't know if it's a certain area of the US, but gosh, what was it? The wife of the fellow that owns Dell Computers and
Yeah. Yeah.
the,
Michael Dell, I think his name is.
yeah, but
Yeah.
there's a lot of those
Yeah. So
women that
Mar-a-Lago
sort of
face.
look similar, right?
Yeah.
It's like
Well,
So
I
they
think
overprint.
that's a social adaptation, right? Like as
yeah.
human beings, we like to fit in. It was a survival
Yeah.
instinct, evolutionarily. So if you look and act the same, then you are safe at
Hmm.
the root. So, and that's why you'll find certain aesthetics in different pockets of the world, or you have that like
Yeah.
Hollywood face or the Mar-a-Lago
Yeah.
face,
Yeah.
because it's happening everywhere around you. So suddenly when you start to feel different, you start to try to mirror, or you even see it in like, teenage girls, right?
Hmm.
They all
Hmm.
like,
Yeah.
you
Mhm.
get a group of girlfriends together. They seem to eventually all kind of look the same. The hair is the same. The outfits are the same. They talk the same. It's social
Yeah.
adaptation.
It is.
Um,
It is. Yeah. I think then it's interesting because you see that in other situations, but this Mar-a-Lago thing if you think about it in that light, Christelle, as you mentioned, it's very much to fit into a social expectations, right?
mhm,
Because that entire culture is around assimilation and around similarity and you
mhm,
know being very very similar like you said, right?
mhm,
So
Belonging, I
it is
guess.
belonging, yeah. And
mhm,
so if someone higher on the social hierarchy starts to look a little certain uh, enhanced, let's call it, there's
mhm,
this trend towards becoming more enhanced looking. And you see this in other cultures, like in Russia. People
mhm,
who get
Right.
aesthetic treatments want to make sure that those aesthetic treatments are seen or visible
Mhm.
to other people on purpose because it signals status, right?
yeah.
I recently had a patient who came in, and she was originally from the Middle East, but she had beautiful, curved, very natural looking eyebrows, but that's not the look she wanted. With
Mm,
Botox, she wanted a fox eye look. So to flatten the middle curve
mm,
of the brow, lift the tail. And, we got a very straight look. And to me, it was very striking. And it's not something my aesthetic
mhm.
sort of resonated with, but it made her feel happy. And it's Botox is a treatment that does not cause permanent disfigurement
Right.
or
Mhm,
harm. So that's one thing that people should know. Uh, but
mhm.
but um, but people's aesthetic sort of look can vary regionally for sure. And one last place that I've seen it and wanted to touch on is actually plastic surgery conventions. So,
Yes.
when I've gone to a plastic surgery convention, everything is just a little bit more enhanced. It's changing now as the overall
Mhm.
culture of plastic surgery is changing, but still, you see lips sometimes, many, many lips, and you're surrounded by lips that are
Mm,
slightly anatomically different. And it's very slight, but you can see it. And then
mhm.
over the course of the 3, 4 days that you're at the convention and you're like, you kind of don't see it anymore, and you think,
Yeah.
"Is that
No,
normal?"
Yeah.
Yeah, it's very
Mhm.
interesting.
Huge. It is.
it's
And then like it's a slippery slope. We haven't touched on it, but there's an element of body dysmorphia that occurs,
Yes. Mhm.
which is quite predominant in this industry because some people are just continually chasing further improvement, and then they get so used to that face that they spot something else, and sometimes it's a deeper issue. It's a psychological concern, and they're looking externally to address that.
Yeah, yeah. How would you describe body dysmorphia to people who don't know what that means?
That is, I'm not going to give you the DSM definition because I can't think of it off the top of my head.
Just
um,
the pop, pop,
but to
pop
me,
psychology.
it to me is a disconnect between how one perceives themselves with how others in the world see them and how
Right.
they feel
So
internally. And it's
So, like
often,
someone who always thinks that they're overweight, but when you look at it
yeah,
objectively, they're
yeah,
not.
very
That
similar to
would
say
be a
like,
form? Yeah.
yeah, like similar to people who have like an eating disorder who would think that they're overweight, but they're not. These people will think
Yeah.
that a certain body part to them is very ugly or grotesque, and in reality, it isn't. And there's oftentimes like a deeply rooted psychological issue around like self worth.
Yeah. Yeah. And I think when we see those people, it behooves us to have those conversations and
Hmm.
make the referral to the right people to help
Hmm.
them and not to do further harm. Right.
Yeah,
So I think that's key. So,
yeah, yeah.
I think of the young ones that come in and I think, "Oh my gosh," like, it was hard enough growing up when, you know, being a teenager in the '80s, and you had all of these, like, skinny models and, it was the era of the supermodel, right? And,
yes, it's coming back.
yeah, like
I
Linda
know.
Evangelista, I'm trying to think of all Christy Turlington, all of those gals, and,
Cindy Crawford.
you know, that that was one thing, and I never was gonna compare to or add up to any of those kind of women, but social media is just a whole other level. Like you've got these young girls that are, everything's so filtered and so fake, really,
It
for lack of a
distorts
and
your concept of reality from a very young age.
very
Right.
young age, right? And so they're coming in, and you maybe got somebody that's like 19 or 20, and they're wanting lips that look like this picture, which okay, maybe that looks good on that person and in that photo and that angle with that, but that's not actually what that person looks like in real life. And then to make it worse, these aren't models and superstars. This might be somebody that lives down the street for them or a friend of a friend, but it still looks so amazing, but it's so fake.
Yeah, because
And
they have filters or they have AI modification, or the influencer you're following is AI. That's a whole
oh,
nother
okay,
level.
that's a
That's a whole
whole
other
other
conversation.
scary can of
Yeah,
worms,
that's
right?
a whole other conversation.
So then as a provider, I think it's a bit of a struggle because
Mm,
I feel like we do such a good job of really keeping the patient's best interest at heart. You want to give these young girls a little something so they don't go somewhere and do something crazy.
Mhm.
Yeah, I don't know if that maybe
Yeah,
is
I
something
think,
worth mentioning.
yeah, so I think it comes down to how do you not look weird? So you wanna do something, you're not sure
Mhm,
what would keep you looking not weird, and I want to touch on also what does Botox do versus fillers, because to your point, everybody who comes in says, well, I don't, that person had Botox and they look weird.
mhm,
Well, how do you
Yep.
tell the difference between one and the other? So generally, if you see people who are puffy or they have enlarged cheeks or their lips are bigger, that's not Botox, that's filler. And Botox works by stopping muscle movement, right? So it
mhm,
just stops muscle movement so your skin can fix the wrinkles that you kind of etched in there for
mhm,
repeated creasing. So if somebody might have a dropped brow or they don't have movement in an area of their face that would normally see movement, like the crinkles of your eyes, etc., that's more likely to be Botox. The beauty of Botox is that it goes away.
mhm,
There's no permanent damage that can happen to you with Botox. Um, I feel very confident that that's a safe treatment. And if you don't like it, it's going to go away. So for those of you who are considering, stepping into something,
mhm,
Botox is pretty safe. I say that with my chest as a family physician who's interested in your health. Right. So fillers are different. I look at them as being somewhat semi-permanent. People
mhm,
feel like, oh, I can get filler and it'll go away in 6 months and then I can just top it up or whatever. It doesn't work like that. So, in my opinion, they are semi-permanent. You need to approach them with a little bit more caution and
mhm.
small amounts, and work with somebody whose aesthetic that you respect, and also somebody who's going to tell you no,
Yeah.
and guide you, right? So that's key. And good skin looks good on anyone. So you're never wrong, sort of investing in good skincare and protecting your skin and all that. So,
Mhm,
those are some easy things to do.
mhm,
Yeah, and don't focus on one thing, right?
Yeah.
One feature, one line. Try to look at the overall impression that you're experiencing when you look in the mirror, and share that with your provider. Like, hey, I feel saggy. Not, can you give me a
yeah,
syringe of filler in my nasolabial folds, which are
yeah.
the lines from your nose to your smile lines, right? So,
Mhm.
those are kind of the tips and tricks that I would have. Do you two have anything that you would suggest to patients when they're looking to venture into this?
I would say kind of tagging along what you mentioned about having a global picture and maybe taking a step back, bird's eye view. Also,
Hmm.
having a variety of photos, because one photo can just catch you at the wrong angle and the wrong light, and that's not actually a concern. And
Hmm.
you see yourself as a reflection, so it's very different to what others see of you. And you really can only see yourself front on. And when we do the assessment, we're really taking a global assessment. And I mean,
Right.
I even, it takes me back to a consult I had today, like those photos that we take from all angles. I think if you have a provider who will sit down with you and show you your face from multiple angles and explain what you're seeing, and why it's happening from all those different angles, that can give you an understanding, both what's going on and can help you zoom out from that one area. Like one of
Yes.
the that consult I had today was very much came in. I don't like my nasal labial folds and my marionettes that are happening. And then
Right.
when we looked at the global picture, she had a was very lucky, had really nice chin projection, but she had a lot of temple volume loss. She had a lot of loss in her cheeks and then just in front of her ears, the preauricular area.
Right.
And she just needed that support back. And we took a lot of time to go through that. And you could tell she was like, oh, like understood, and then was completely
Right.
moved away from looking there. And
Hmm.
could even, she was one, we always will have a bit of asymmetry. So difference between our right and our left face. And
Right.
hers were much more prominent on the left, less on the right. So when we looked at the right versus the left, she's like, oh, and like from the different angles, she could really understand. She said, well, I've never seen myself
Right.
from that angle before. Um,
Exactly. Yeah.
Having that, if you have a practitioner that's engaging with you that way, that is quite helpful. Do you have anything
Yes.
to add to that?
Absolutely.
Oh, I would just say, like I've said before, if the person that is treating you looks odd, you're not in the right place,
Yeah.
So we all have our ideas about what we think is attractive, and it can really vary from one person to another. So,
And
I mean, if you like giant cheeks and giant lips and your provider looks like that and you feel great, go for it. But
Mhm.
if that doesn't feel, if it doesn't resonate with you and that person looks odd, then you definitely want to run out of there.
Yeah, don't
you
be
know.
scared to leave. You
Yeah, well,
don't
that's the
have
thing.
to you don't have to commit to a treatment that day, so, remember that.
Exactly. Yeah.
Can you
Yeah.
talk about
Yeah.
Lindsay
Well,
Lohan?
I don't know that
Oh,
much about Lindsay Lohan. Tell
So
I
me.
I
feel
feel
like
she's
she
more
looks
my
amazing
generation.
right
Like I'm
now.
pretty sure you're the same age or only a few years apart. But I feel like there's this wave of moving away from that Mar-a-Lago face to
Mhm.
more
Yeah.
natural aesthetic that's starting to creep in. And
Yeah.
from what I'm seeing on social media, she's almost being hailed as the um,
Mhm.
mascot for what we should be achieving. She looks very different than when she was younger, and then
Right.
as because she's kind of grown up in the public eye.
Right.
Oh, yeah.
To me, she looks quite different. I wouldn't recognize her as the person she was maybe when she was a teenager, early 20s, but she definitely looks
Right.
better than she did at 30. Have a look
Yeah.
on do a
Yeah,
little
Yeah.
she looks
Mhm.
she's beautifully refined, like,
Yeah,
whatever she's doing. Oh my goodness. Um,
Okay, I'll have to take a look.
yeah,
do. Yeah.
Well, the
sign
the
me
other
up.
thing yeah, the other thing I just wanna mention, because we talked about Botox and fillers, but one thing that we didn't touch upon was biostimulatory treatments,
Mhm.
like polyalactic acid or calcium hydroxyapatite. Beautiful, beautiful treatments that work with your body to make more collagen and
Mhm.
really counter some of the changes that happen with aging. And, now with the advent of sort of medical directed weight loss with
Mm.
GLP-1s like Ozempic, et cetera, we're seeing a lot of skin changes and volume loss in the face. And
Yeah.
these biostimulatory treatments are perfect for that. And it's also perfect for people who don't want rapid change in their appearance,
Mhm.
but they want to do something to sort of counter the collagen loss that happens with age. So I don't
Yeah.
want to forget about those. So there are so many options. You do not
Mhm.
need to be scared of looking weird. Just work with
Yeah.
the right people and with the right mindset.
Yeah.
Yeah, I think that's exactly it. And I think it will be interesting to see, like, in the next 10 years, what we sort of see coming out of Hollywood in terms of, I'm
We're
hoping that it's the pendulum swings back towards looking a little bit more anatomically
I think it's
accurate.
swinging. Yeah, I think
it's
it's
swinging.
swinging.
Yeah.
Yeah.
Conversations we may have in future episodes is maybe exploring a little bit more in depth what biostimulation and
Yes.
bioregeneration means and what those treatments are, and also
Yeah.
caveats with that because there's so much excitement in the field that sometimes industry is ahead of the research and the data. So there's always a fine line to
100%.
walk, but I think we have very interesting times ahead in terms of
Absolutely.
aesthetic treatment options.
Yeah. And on that note, if you have questions about any of these treatments that we talked about today, please shoot us an email, info@thebeautyequation.com. And like, subscribe, share with your friends. And we look forward to seeing you on future episodes.
Take
And
care.
that's me. Bye.
Bye for now.
Before we wrap up, just a quick reminder. While we're medical professionals, everything shared on the Beauty Equation is for informational purposes only and isn't intended as medical advice. This podcast doesn't establish a doctor-patient relationship, and any medical or aesthetic decision should always be made with a qualified healthcare provider. Our views are our own and don't necessarily reflect those of our employers or affiliated organizations. And remember, the field of aesthetics is always evolving, so information may change over time. See you next time on The Beauty Equation.
Thank you for tuning in today. If you enjoyed today's episode, don't forget to like, comment, and share it with someone who might need to hear it too. We'd love to hear your thoughts or questions. You can send us an email at info@thebeautyequation.com, and you might hear your question answered in future episodes. You can also find us on Instagram at Dr. Christelle MD, at H. Lotay MD, and at Crow's Feet in Confidence. Until next time, keep questioning the equation.